Hello everybody and welcome back to another video. In today's episode we are going over proper injection techniques or a guide over injecting properly. My name is Andrew French. I am not a doctor. I am just somebody who likes to gather information, puts it into a small PowerPoint that hopefully most people can understand. The overview for this video is needed supplies, IM intramuscular or subcutaneous injections, needle gauges or the diameter of the needle and the lengths of the needles, ways of pain management, and the actual steps of injection. Supplies needed are alcohol swabs, sterile syringes of appropriate size, medication or solution of injection, sterile gloves, which is optional if you're injecting yourself and is a little less optional if you're injecting somebody else, but also depends. Sharps container, which can be an actual sharps container that you can buy off of Amazon, or even just a detergent container, just something that is thick and plastic and it can be sealed. Cotton balls, gauze pads, or band-aids, just in case if you bleed just a little bit more than usual. IM intramuscular or subcutaneous. IM injections are deep into muscle tissue for a faster absorption rate and can hold a higher volume of medication or solution. The sites commonly used are the delts, vastus lateralis of the quads, and the ventroglute. Sub-Q injections are into fatty deposits under the skin for a slower absorption rate and can hold less volume. Sites commonly used are the abdominals, thighs, upper arms, and lower back. So here we can see intramuscular injections. Here's the deltoid. Most people make a triangle and just hit within that area because it is less vascular, less likely to hit a vein. Over here we have the vastus lateralis, which is this muscle all the way over to the outer side of the quads, closer to the ACL. Here is a gluteal picture up here. Upper right is where you're trying to hit, but best is to cut the glute into 4 quadrants like this and hit for this upper area. Same with the left. Divide it into 4s and hit over here or in this region, just less vascular. Sites of injection continued. Over here in the lower left corner we have insulin injection sites, which is also subcutaneous. Most people use the abdominal region because it's pretty wide and you can even wrap around to the side and even lower back area as well. But main cause is to steer clear of 3 inches around the belly button because it is a more vascular region. You can also do upper outer thighs, just pinch the skin and inject. You have the gluteals as well because it is a pretty fatty region, and upper outer arms. Over here with intramuscular, you want to go out at 90 degrees. You can also do this with a sub-Q if the skin is thick enough and there's enough fat in between the muscle and the fat. Also with subcutaneous, you can go at a 45-degree angle just to hit it better, more under the skin. Same with over here, just what you're going for. This is intravenous. You don't want to do this. Needle gauges and lengths. Smaller to larger diameters. So it's kind of the opposite. The higher the number, the smaller the diameter of the needle. The larger the number, the smaller the number, the larger the diameter. So 32 is an insulin needle, and 18 gauge is pretty much a needle that you draw medication from and then switch off later. Intramuscular injections usually use a 22 to 27 gauge needle, that is 1 to 1.5 inch. You could go smaller, but it just really depends how lean you actually are. Subcutaneous is a 25 to 32 gauge needle. 32 is the smallest that I've seen that you can buy, and it hurts less. These are usually 3/8 to 5/8 inch needles. Choose based on injection site size of muscle to fat and viscosity of your medication or solution. Like I said, delts, you can do front, left, or rear. You can also inject your lats, glutes, upper, right, and left quadrants. Abdominals, stay clear 3 inches from the belly button, and quads, which intramuscular can be risky because a lot of people do get inflammation and all kinds of nasty things with quad injections. Not saying that's less safe, it's just something to look out for. Ways of dealing with pain of injection is to have a room temperature medication if it is a oral based solution that can help. You can also heat up the syringe with the medication inside under hot water for a few seconds. That can also help. Use new sharp needles with each injection that you do. Do not reuse a needle. If you poke yourself and not draw out medication but pull it out, replace the needle. Relax. If you relax the muscle, it does generally go in a lot smoother. So just have a relax. Don't try to flex. Don't work yourself up too much. But if it's your first time, you will be sweating bullets and having a panic attack. Apply ice before injection or a warm compress after. Another thing that you can do is inject after taking a shower. That seems to help some people. Inject slowly and steadily. This may feel counterintuitive, but if you inject at a slower rate and steadily, it gives your body time to figure out what the heck is going on. Is what I think. But just don't slam it all in there at one go, especially if you have a higher volume of liquid. So, the actual steps for injection. First, wash hands thoroughly with antibacterial soap, or at best, use Germ-X, please. Just clean yourself somehow. Prepare all supplies, get out all the needles, all the injection needles, all the drawing needles, all the alcohol swabs, all the vials. Clean vials of whatever medication or solution that you're using. Use the alcohol swab to clean that off the top part. Unwrap and take cap off needle. Draw medication into syringe of appropriate dose. Remove most of the air. If there's a few bubbles left, that is fine. Air embolism is actually quite rare and requires a lot more air than what you think. I forget the exact ratio, but it's about 3 milliliters of air for, 1.8 kilograms of body weight. So if you weigh 300 pounds, you would have to inject about, let's say 150 milliliters of air into yourself. So, and that's a lot. That's a lot of air. Nobody's going to accidentally do that. Switching to injecting needles. So typically, you use a drawing needle, like that 18 gauge, to draw your medication, and then switch to a lower diameter needle for injecting. It is also sterile and clean. Swab injection site in any of those areas that you're deciding to inject. Push the needle 90 degrees into muscle or 45 to 90 degrees into that subcutaneous injection site. Slowly and steadily inject medication. Pull out and dispose of needle into sharps container. This is where you would apply cover if you are bleeding. And congratulations, you have injected safely and properly. Thank you for watching. I am working on a few videos. I will go over dosing, how to dose medication properly that is required or what you need. I am also working on a larger video on how to read blood work and all the intricate things that go into that. Because most people get blood work done, they have no clue what they're looking at. They see some red, they see some yellow, and they see some green and think, okay, I'm either dying or I'm okay. So that's something else to look into. But thank you for watching. Like, subscribe, and comment. Follow me on at French.ie_lifts on most social medias. Sometimes the F is capitalized, sometimes it is not. But once again, thank you for watching, and I'll see you in the next one.